We were all very happy. The first thing he said was Mama. Everyone was very happy. Now he slowly started speaking a lot. And my son's name is Danish Ahmed. He has undergone cochlear implant 2 years ago. At the time when we got to know that he is having this hearing impairment, he was already 3 and it was too late. But still we contacted Dr. Shree and she suggested about cochlear implantation. I did consult many other doctors. Few suggested for hearing aids, few suggested for cochlear implantation, and I was very confused. After meeting Dr. Shree, I was a bit relaxed that there is some scope that my child can improve. Then finally we decided to undergo the surgery. When the surgery was done, our whole family was very scared, but then the surgery went very well. Dr. Shree supported us very nicely. At first, people were not aware about what is this. Wherever we go, everyone used to ask, what is this? What is he wearing? But now, when slowly people started knowing about it, now everyone knows what is it and how to react with him. So when I got to know about cochlear implantation, there were many people who were saying that the surgery won't be good. It's such a long surgery. How can the child cope up with the surgery? There was lots of questions from many people. I decided that I need a better future for my son, so I went for the surgery. When the machines were on, he was very startled. He was scared about the sounds that he was hearing. Then he started adjusting, and then when he said his first word, that was a most memorable experience. It took around 6 months. Initially, he was just adjusting with his cochlear implants. Then slowly he started babbling, and then he started responding and speaking. The future is in our hands. If we don't care about the money, then we can secure their future. We can't keep our child always dependent on ourselves. We can't guarantee that we are with them all the time. As a parent, I think cochlear implant will be the best option, because if the hearing loss is more than 70%, we can't go with hearing aids. The hearing aids won't help. Initially, doctors will suggest to go for hearing aids. Then there will be again loss of time with 3 to 6 months. If we go for cochlear implantation, then it will be very helpful in early stages only. During the time of surgery, she told me, don't worry, your son is like my son, and I will take care of him in every possible way. And that has gave me much courage to undergo the surgery. So I think she is very friendly and supportive doctor. Now I feel very happy when I see my child speaking. Now he goes to normal school and studies well.